The ARC is committed to increasing the public's awareness of the healthcare needs in the intellectual disability community.
We believe that people with intellectual and developmental disabilities need to have access to good quality health care, and that's really essential to their being included in their communities.
There are large health disparities in the intellectual disability community. Researchers report that as many as 55% of people with intellectual and developmental disabilities are obese, a rate almost twice that of the general population.
That health disparity is critical because we have folks who are not receiving the right care in the right place at the right time. And because of that, it really impacts their quality of life.
You here for your 11:30?
Yes, I am.
Many healthcare providers do not feel adequately trained to serve patients with an intellectual disability. The ARC is working to address this issue.
Take some nice deep breaths for me.
The ARC has had the pulse of the community of people with intellectual disabilities since 1950.
The ARC is the nation's largest and oldest nonprofit organization serving people with intellectual and developmental disabilities. And we do that through a network of about 675 chapters in 48 states and the District of Columbia.
We serve more than 1.4 million individuals with intellectual disabilities and their families.
The ARC's mission is to promote and protect the human rights of people with intellectual and developmental disabilities and actively support their inclusion and full participation in the community across their lifetimes.
We inspire, teach, and support people with intellectual disabilities to adopt health and fitness habits through our local health programs and our national initiative, HealthMeet. Nearly 30 sites in 5 states have brought HealthMeet activities to their local communities and provide user-friendly information to people with intellectual disabilities that encourages them, their families, and caregivers to adopt a healthier lifestyle.
So that's yours to go home with you, okay, Jessica? And next time you go to the doctor, you can take that with you.
Our chapters create health promotion and health literacy as part of their activities. And so instead of just going through a health screen and having that experience, which I think is really critical, they're also talking about sun health and hydration and nutrition and food portions using models so we can talk about a tangible amount of food. And I think that those pieces have really taken a concept of health and broken it down into pieces that are really accessible to a broad audience. And that's something that I've been really proud of, watching our chapters take the lead on that.
The ARC is also working with local public health departments and universities to increase the knowledge and skills of their healthcare providers so they are better equipped to deliver quality healthcare to people with intellectual disabilities.
We've definitely noticed that a lot of participants have issues with kind of basic things that we take for granted as, basic components of our health, like foot care. A lot of them have earwax kind of blocked. So simple things that you or I would be able to take care of on our own, but these participants just kind of don't notice and their doctors don't notice.
Tuesday was the first time you wore them last week, right? And her feet looked great.
We want the next generation of healthcare providers to be prepared to work with the intellectual disability community and provide them with the same level of quality service they provide to people without disabilities.
The relationship between the ARC and Drexel University has really been wonderful. The nursing students have learned how to communicate with adults with developmental disabilities. The medical students have said that they've had more fun here than any other work placement they've had. From the perspective of the participants, they've enjoyed going in to get their HealthMeet assessment. They've developed relationships with the students as they come in.
I think working at the ARC will definitely have a huge impact on my career. Even if I don't go into a field where I'm working every day with adults with intellectual disability, just working with this population gives you so many tools to communicate and really forces you to listen to what's going on with a person, and kind of just puts you in a different mindset where you really want to know, okay, this is what you're saying or what you're capable of saying, but what's really happening. And I think those are all good things for a doctor to be able to use.
If you are a chapter of the ARC or a healthcare or other service provider, contact us and learn how you can participate in HealthMeet and help end healthcare disparities experienced by people with intellectual disabilities. Together, we can prepare and motivate people with intellectual disabilities to achieve their optimal levels of health.